Hi, my name's Jared Wright, and today we're going to cover a little bit on adolescence and substance use. We're also going to go into what we can do to try and help. So we're going to talk a little bit about current adolescent use. Now, a 2002 report shows similar percentages to those shown here in my infographics at the right. The most frequently used substance by adolescents is alcohol. Tobacco, on the other hand, is second in overall use, and marijuana is third, followed by amphetamines and hallucinogens. Over 70% of high school student seniors have consumed alcohol in their lifetime, which is equivalent to what is shown on the right-hand side of the screen. So how are we going to try to address these issues? Well, we can look at some things that we've tried to do in the past, like public service announcements, and see if those have actually helped this issue at all. Oddly enough, despite tremendous cost and effort, there's been no evidence that shows that public service announcements have reduced use. In fact, one study that I covered showed that between 2002 and 2003, while these ads were running, there was actually an increase in use for those between 14 and 16 years of age. One 2009 study focusing on marijuana use sought to find why this is. This study focused on two groups, one being high risk and one being low risk, of adolescents that were shown public service announcements that portrayed marijuana use and public service announcements that didn't portray marijuana use. And it was shown that those portraying use were seen as less effective. It also divided these PSAs into two groups, one being those that contain strong anti-marijuana arguments and those that contain weak anti-marijuana arguments. And the ones with strong arguments were seen as effective by those at low risk and ineffective by those at high risk, which is unfortunate because those at high risk are probably the ones we want to try and persuade the most to not use substances. So here we go. We'll look at two examples, one of an old anti-marijuana propaganda advertisement and one of a more recent anti-marijuana PSA that you may be familiar with that ran in the 90s. Both are very different, but have similar qualities in the way that both are making a very strong claim that is likely to drive away those that are at risk, which ultimately makes them ineffective. So, along with that, and the use of messages that are not based in a whole lot of evidence, basically we just need to see a drive towards a much better understanding of the drugs overall in order to understand how to better prevent use. For example, one study covering marijuana used a longitudinal method and found little to no correlation for long-term use with negative effects. Now, this study is limited in the realm of viability. It had a very, very small group of participants, but it did kind of help limit other factors such as tobacco use and the use of other drugs or substances. So it tried to narrow in its view on just marijuana use in the same individuals over a long period of time. That is not to say that there are, for certain, without a doubt, any negative side effects for marijuana use, but it does go to show that we do need to look into these substances further. And right now that's kind of difficult overall, just with the questionable legality within the use of these substances as a whole, especially right now with marijuana. So we'll go ahead and move on to how we can work on these issues a little more effectively. And that is simply to develop a better understanding of adolescence in your life. And that involves looking at the risk factors and protective factors and getting to know the adolescent in your life well enough to be able to recognize those factors. It is important to know that risk factors can vary depending on ethnicity. So, for instance, in one study, based on ethnic and racial groups, there were differences seen. For instance, white individuals saw a higher percentage, showing 7 or more risk factors, while black individuals saw a higher percentage of overall mean risk factors. However, black individuals also saw the lowest proportion of lifetime use overall. So it's good to know what your adolescent may be at risk for and then keep an eye on that, and then try to promote protective factors such as strong family bonds or parental engagement in that adolescent's life. Hopefully knowing potential risk factors and promoting protective factors will eventually make all that difference you've been looking for. Thanks, and have a great day.